Hello and welcome to Aesthetically Speaking. I'm Paola Chellew, a medical journalist for Aesthetic Appointment, the expert online guide to aesthetics and pro-aging. And today I'll be chatting to Dr. Debbie Norval, a medical practitioner who graduated here in Johannesburg at Wits University and then went on to specialize in aesthetic medicine. She sits on the scientific committee of the Aesthetic Medical Congress of South Africa. She's past president of AMSA, the Aesthetic and Anti-Aging Medical Society of South Africa. And despite having a very busy practice in Parktown North, she takes the time to teach and to train other doctors in various procedures, techniques, product placement, and also new products that are constantly flooding the aesthetic medical market. And that's what we'll be doing today, chatting about a new product brought out by Tassosol called which is a targeted treatment for the eye area using biostimulation and polynucleotides. New buzzwords in skincare today, which we will unpack for you on Aesthetically Speaking.
So, Debbie, thank you so much for joining us today on Aesthetic Appointment. I'm going to dive right in and ask you to explain what polynucleotides are.
Well, thank you so much for interviewing me. That's very exciting. Polynucleotides, so they're the new kid on the block. The word poly is referring to long. Nucleotides are the building blocks of DNA. So it's long chains of DNA. It's actually quite tricky to understand. So the way I understand it is we all know that proteins are made up of amino acids. So amino acids are the building blocks of proteins.
Right.
Well, nucleotides are the building blocks of DNA.
Okay.
So a polynucleotide is a piece of DNA. And the polynucleotides in nucleotides are derived from wild salmon sperm cells. And they found that these particular salmon cells, their DNA is very, very close to human DNA. And they've taken the polynucleotides and they've highly purified them, removed all immunogenic markers, and they've suspended them in a hydrogel. And so that gives you a really nice biostimulator that's made up of fragments of DNA. And that can influence the cellular processes in a human skin.
Right. All right. Well, then let's rewind a little bit and concentrate on this eye area and just tell us why it ages more quickly than any other area on the face.
Yep. So talking about the eye area is really relevant with polynucleotides because the place where they shine the most is in the eye area. And I'll explain why later. But the eye area is the first area on the body to age. And I think one of the reasons is that the skin in the eye area is the thinnest skin in the body.
Yes.
Even in a healthy young person, the skin under the eyes is less than 0.5 millimeters. So in an older person with loss of elastin, loss of collagen, loss of hyaluronic acid, that skin gets even thinner. So the skin around the eye area is very crinkly, crepey, saggy, dehydrated, and unfortunately it's the very first place that shows aging. But then the eye area is also very prone to puffiness.
Yes, because it's not just the crepiness. Now, tell us what the other issues are. Not that we don't know, we actually do know what the other issues are, but just go through them.
I'll just go through them. So
eye bags.
Puffiness, under-eye puffiness, it can be caused by allergies, it can be caused by sinusitis, but it can also just be caused by poor lymphatic drainage. And a lot of people have what we call malar festoons, which are these little puffy little bags on their cheeks, and that's actually it's lymph that's trapped in the tissues. And if patients have had any under-eye fillers or any fillers in their eye area, they're very, very hygroscopic. They draw in water, and that's going to make under-eye puffiness even worse. So puffiness is a big problem, but then a lot of people also have pigment under their eyes.
Okay.
And that's such a tricky thing to treat, and it contributes to the dark circles. And then that's not even talking about all the other eye aging, Paola.
Yes.
I mean, there's bone aging, there's fat pads.
Yes, so we will come to that. Just tell us what treatments are available for that area. Are there fillers? So you mentioned fillers. So what would fillers do as opposed to
Okay, so a filler, that's the giveaway. It's for volume loss. It's for structural issues under the eye area. So a lot of people, their under eye problem is nothing to do with structural deficiencies. So fillers are good for when there is a structural deficiency or what we call a tear trough deformity. That's a small percentage of people. They do have their problems in the eye area and they need to be injected very carefully with much precision. The doctor needs to know what they're doing. They need to know their anatomy, and the product is very, very important. And if the wrong filler is used in the wrong tissue plane in the eye area, you end up with sausages. You end up with something called a Tyndall effect, which is a bluish violet discoloration of the under eye area, which makes everything even worse.
Oh, yeah.
And fillers have also got quite serious complications around the eye area.
Yes.
It's considered a high-risk area. If filler gets into the eye, blood vessels that supply the eye, it can actually cause blindness. So the fillers are not our first go-to with the under eye area. It's something that will be used very judiciously. Definitely not your first choice.
All right, then why would we opt then for biostimulated?
I think it would help to go into what polynucleotides do, because that will actually explain why they work so well for the eye area.
All right.
Polynucleotides, the first and the most important thing they do is that they increase what we call the proliferation and migration of fibroblasts. So fibroblasts are cells that make collagen, elastin, and hyaluronic.
All the goodies.
Yeah,
all the goodies.
Yeah. They not only increase the number of fibroblasts in the area, but they actually increase the metabolic activity of those fibroblasts.
Oh, okay.
So a filler doesn't stimulate fibroblasts. Yeah. So this is something that gets your body to do its own job. So it's wonderful to get extra elastin and collagen in the eye area. Yeah. It's also wonderful to get your own hyaluronic acid in the eye area because that's endogenous. It's your own natural hyaluronic acid. So you're not going to get the problems that you get with fillers. Yeah. And I think the most important thing about polynucleotides is the effect on fibroblasts.
Yes.
Our favorite cells.
Yes. But then what about the bone?
Before we even speak about bones, there's other important effects of polynucleotides in the eye area. They actually work on melanin production. So they modulate melanin production. They modulate the melanocyte cells. Okay. So they actually reduce pigmentation, which is a total bonus in the eye area. Yes. Yeah. They also promote what's called angiogenesis. Mm-hmm. Angiogenesis is just a fancy medical word for new blood vessel formation. Okay. And here are we talking about the microcirculation. Okay. So when the microcirculation in the eye area is improved, there's a much more blood supply to the eye area. There's drainage of toxins, there's drainage of pigment, and also alongside increased microcirculation, you're going to get an increase in your lymphatic drainage. So polynucleotides are also helping with lymph drainage.
So less eye bags, less pigmentation.
Yes. And more blood supply, more oxygen to those tissues that desperately need oxygen.
Okay.
And they've also got antioxidant effects. Polynucleotides have antioxidant effects, and this in the eye area is a total bonus because obviously it's going to scavenge free radicals.
Yes.
It's going to help with UV damage. Yeah. It's going to help repair and regenerate. So antioxidants are also fantastic for pigment. Okay. So yeah, really polynucleotides, they work in so many ways around the eye area before we even speak about bone.
Okay, but do they?
So polynucleotides that are for eyes are called that's designed to be injected into the skin, very superficially. And we'll talk about technique.
Yes, we'll talk about technique.
But polynucleotides come in different viscosities and concentrations. So there's a so the strong one can be injected quite deep on the bone or in the deep fat pads. And it's actually shown to prevent the breakdown of bone. Because as we age, our bone remodels and resorbs. Polynucleotides help to delay that. But they also help to produce fat. They are lipogenic.
Okay.
So that's something to bear in mind with polynucleotides is they can actually promote fat in the skin, which is nice because it creates like a padding, like a duvet.
Yes.
But if a person has a prolapsed an infraorbital fat pad, then you want to actually avoid nucleotides. So there are
okay. So they are so let's talk about that. Candidates for this particular treatment, the ideal candidate. Me.
We're all candidates. Yeah. The minute you start to see aging around the eye area, the minute you start to see the crinkling and the crow's feet developing, you can start with polynucleotides. What's so nice about them is they don't have side effects. I think that's the most incredible thing about a polynucleotide. It's like the only side effect might be slight swelling for a day, if that, and maybe a bruise, which is not even an adverse effect. That's an expected effect in patients who bruise easily, but usually there's no bruising.
Who shouldn't?
Oh, okay. But just to go back to the previous question, polynucleotides are not just for wrinkles, they're for pigmentation, for lymphatic drainage. So any eye issue really.
Yes.
But who shouldn't have polynucleotides? It's actually very simple. People who have an allergy to nucleotides, people who have a lot of fat prolapsed under the eye, and that's those people that have that big bag bulging. They actually need surgery. They need surgery. And people who have just really, really a lot of edema of the lower lid, because it's a liquid. Polynucleotides are liquid, and we're just going to be injecting liquid into an edematous area. Just going to make it look worse.
What about any chronic medication that people are on?
No, it's just the normal rules apply. If you're on anti-inflammatories, if you're on omegas, if you're on aspirin, your chance of having a bruise is higher.
All right, but before we jump into the actual procedure, just something that most guys and girls are having nowadays are botulinum toxin injections. The question probably on everyone's lips will be, can I stop my injections, or should this procedure be sort of done in adjacent to your injection?
It's a good question. So first of all, the botulinum toxins working on muscle.
Okay.
It's reducing the contractions of the muscle, whereas polynucleotides are working on the skin. So they actually complement each other. However, there's certain people that if you can improve their skin quality, then those repeated contractions of the muscle under the skin is not as visible, because the skin's
You could maybe, in an ideal world, it could be that you lessen how frequently you have.
Well, I think you would still do it every 4 months, but I would maybe give a little less.
Yes. All right. Well, take us through the actual procedure. Could one numb at home, or is it more advisable to come into practice and have your doctor numb for you? Because it is that delicate eye area.
I actually prefer the patients to come in 15 minutes earlier and just apply the numbing here. Firstly, because my numbing cream is quite strong. So I really wouldn't want someone to have that at home. If your eyelashes touch that numbing cream, it gets into your eyes and it stings. And then if the person's driving, it's probably not practical. So it's best if they come in and then they can put the numbing cream right up to the eyelashes, just not touching, and in this area here and on the top lid as well. And then just have a cup of coffee and wait for their appointment.
And then what happens? Dr. Deb will take us through.
There are 2 ways to inject polynucleotides. The one is with a needle. And it's really a tiny little mesotherapy needle, and it's very superficial injections. So it's uncommon to bruise. You get little intradermal blebs, which are like little bumps on the skin, like little bee stings, And generally we do 2 rows on the lower lid and 1 or 2 rows on the top lid. Some patients just treat the lower lid. So they're going to have a few little bee stings for an hour or so. And that's if they have the needles. If the patient absolutely cannot possibly have a bruise and they prefer a cannula, then that involves 1 entry point each side, and we just inject the polynucleotides under the skin using a blunt, flexible cannula. The cannula the patient does need to pay for. It's a little bit extra, but the chance of a bruise is lower with a cannula.
All right. And then post-procedure protocol, what happens at home? Is there any downtime? Well, you said there shouldn't be any downtime.
Well, in most patients, literally press on the area with a cotton wool pad while I'm writing their notes. And the bumps have already gone by the time I've done that. But I do like to offer them light therapy straight afterwards.
Lovely.
The red light, which is anti-inflammatory. It just helps them just to recover quicker. I put a little bit of medical concealer on, and off they go. They can go home via Woolworths. No one's going to even notice.
Fantastic. That's what we all want. Right. We're going to wrap up, but I'd like to know how many treatments are needed and how many weeks apart.
The protocol is to try and do 4 treatments, between 3 and 4 treatments, 3 weeks apart. Thereafter, you can maintain those results by doing a treatment every 6 months, just 1 treatment every 6 months to maintain your results.
And then the last question, I think the golden question is, you won't get the instant gratification of a filler. So how long before you see the effects of this wonderful procedure? How long would I have to wait, say, for my pigmentation to fade, for eye bags to subside, and for the crepiness to just look nice and plump?
Yeah, one does have to be patient. A biostimulator is not a quick fix. Your body has to actually make the collagen and the elastin and the hyaluronic acid, and it can take up to 6 to 8 weeks to see a result.
Okay.
So I think the best thing is to do is not even look in the mirror. It will come gradually, and the results are not dramatic. People aren't going to ask you what you've done, but it's just improving the health and the circulation and the lymph drainage, the pigmentation, and just the general health of the eye.
Just lovely, functional, healthy skin, which is what we want. And thank you so much for explaining it to us. And stay tuned for the next installment of Aesthetically Speaking.
Thanks, Paola.
And there you have it. Thanks to Dr. Debbie Norval for explaining everything there is to know about this targeted treatment for your eyes. And remember, we are pro-aging, but if your eyes are making you look tired or sad, it's a lovely procedure to consider. If you want to know the latest in aesthetics, follow us on Aesthetic Appointment. Like and share this video if it interested you, and stay in touch to find out when the next installment of Aesthetically Speaking will take place. Remember to be kind, to be beautiful, inside and out.